It's been 3 years since Russian forces mounted a full-scale invasion of Ukraine. Today, the fighting there is still in full force. Many citizens have fled the eastern part of the country where the war rages on or have fled the country altogether. This includes many doctors, which has created a medical crisis for the relatively few doctors that remain. There just aren't enough medical specialists left in Ukraine to serve the remaining population. Because of staffing shortages in hospitals and medical centers, patients needing specialized care often end up seeing the local pediatrician or a first-year resident who may not know how to address their issues, like a recent heart attack or even an abscessed tooth.
We're seeing physicians being overwhelmed. A lot of physicians have moved from rural areas of Ukraine, so there's definitely shortage of specialists. And for example, where now we're seeing a family physician who has to help deliver babies in the basement without any electricity because their town is surrounded by Russian forces. So it's definitely became very challenging, and the resources are scarce because the country is at war.
That's Dr. Olga Myhudiak, Chief Operating Officer of Global Medical Knowledge Alliance, also known as GMKA. It's a nonprofit organization that provides medical training and educational webinars for Ukrainian doctors. GMKA was co-founded in 2017 before the war started by Dr. Nelia Melnichek, an associate surgeon at Brigham and Women's Hospital and assistant professor of surgery at Harvard Medical School. Seeing what was happening in her beloved country from afar, Melnichek knew she had to do something to help her fellow countrymen. That's when she heard a story that gave her an idea for a medical app that would assist doctors in Ukraine from anywhere in the world.
One of our resident physicians was practicing in a small town, and he had a case with a patient with a tooth abscess, and he didn't know how to pretty much deal with it. So he called his colleague at a bigger hospital in Kyiv who guided him through the entire procedure via a video call. And therefore, this resident or junior physician was able to help this patient. And that is how the idea for Heal UA app, which provides peer-to-peer reviews, was created.
With the help of GMKA and a technology company in Ukraine called Impact, Melnichek created a mobile app called Heal UA that provides peer-to-peer support to medical professionals in Ukraine with other medical professionals in the US and around the world. She knew the tool needed to be a mobile app rather than a computer program so that it could be accessed anywhere with a smartphone. Doctors can take a photo of the patient's injury or clinical presentation and submit a case on the spot. The Heal UA app, which can be downloaded for free, was up and running 3 months after the war started. With this app, isolated Ukrainian physicians can submit a case and get a second opinion usually within 24 to 48 hours.
It's very hard conditions now in hospitals to work. So it's very important when we have someone that could give us any advices. And we really appreciate that we can get this advice very quickly by using Heal app. Because when we download our cases, we can receive answers very quickly and from doctors from Ukraine, but also what is very important for us, we have advices from doctors from USA. And it really helps when, you have doubts what to do, and especially in a low setting conditions that sometimes we need to work through. So it's wonderful to have opportunity to have a feedback from other doctors.
That's Dr. Olya Kostanchak, an oncology hematologist working in Western Ukraine. She was assigned an unconscious lymphoma patient and didn't have the necessary experience to provide proper treatment. Luckily, a specialist in Boston was able to provide her with a diagnosis and treatment protocol through the Heal UA app.
He gave the advice with diagnosis steps and what we can do in our setting, and also how can we manage this patient. And by the way, not only this, but we leave comments about how is this patient going on now. So it's not just for the beginning, but through the whole course of treatment, this patient. And for me, it's just wonderful.
A team at GMKA monitors all submissions to make sure they're from verified physicians on both ends. They also monitor comments to make sure they're medically appropriate. The founders of GMKA hope to see the app used around the world wherever physician and specialist shortages exist, such as in rural India and Africa.
The model is very replicable and it could be used all over the world. And then also, this serves the app and the fact that physicians are seeing these different cases. I mean, even in the United States, we see physicians giving peer-to-peer review. They're seeing cases that they might not see in the United States because, Ukraine or any other country is at war and there is a conflict. So this serves also as that bi-directional educational opportunity because specialists can learn from one another.
Dr. Daria Kizub is a Ukrainian physician practicing at a major cancer center in the United States and offers peer-to-peer review through the app. She says that while posted cases are complex and that this ability to get a second opinion from doctors in the U.S. is invaluable, she cautions against overstating the role of international expertise.
I would like to not overstate the role of international physicians and expertise in this because I think, in Ukraine, there's also a good amount of expertise where we were not available. Of course, it's very helpful, but I don't know that necessarily the patient would die in most cases if this was not available.
However, she does think the app helps to expedite Ukrainian patients' treatments.
One case I can think of is a patient with an advanced form of breast cancer that is very aggressive, triple negative breast cancer. And the question was, do we need to do advanced diagnostics for this patient, or can we just treat them with a targeted drug? Because the advanced diagnostics, the kind of lumbar puncture and kind of waiting for the result would have delayed treatment. So I said, in my practice, or in our practice, you can just treat with this targeted drug. So the patient was able to get treatment faster. And this is for a condition where, it can progress very quickly and patients can die generally within, on average, they generally live about 3 months. So I think it was useful, my advice for the patient to get treatment sooner.
Mahodiak says the greatest challenge in creating the app was translating from Ukrainian to English and vice versa. But she says that AI technology provided a quick solve to that problem.
We're working with Google where we have an AI tool with translation because that was one of our biggest challenges, the translation aspect, and now being able to have AI translation through Google for cases, we're able to reach more physicians and then also more users who will be able to give peer-to-peer reviews. And the goal is to expand this globally, of course.
You can learn more about the Heal UA app and all of our guests by visiting our website at ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.